Some of our city students here at Western Sydney University spend a whole year in a rural location, usually in Bathurst or Lismore, and that really opens their eyes to the possibility of living and working in a rural community.
So all of the Western Sydney students that are here for the 12 months get a placement in an Aboriginal medical service. The placements are variable in times, but generally it is for the students to be able to get a real immersive experience working in Aboriginal health.
For us and working in partnership with the university, we really try to give the student not only a good clinical rural attachment here, but also try to have themselves immersed in the local culture. And we try to have them work across all of our program areas and working closely with our senior Aboriginal health workers.
What's so great about it is that Western Sydney have worked very hard to develop good relationships with the medical services that the students are going to be in, and they're long-standing, 8 to 10 years. The students going into those services, it's not a big surprise to the community.
If we can get out there and we can see how much we can help in the AMS setting, it's going to make a huge improvement to our patients.
I think the Western Sydney program is fantastic because it actually talks about Aboriginal people from the first year. So the students get a good experience and a good paper understanding of Aboriginal people, history, culture and how that affects our health.
So the Western Sydney medical students go to an important Aboriginal site, meet the local Aboriginal community and be welcome to their community, and so they get some idea of what the traditions are and who the custodians of the land are, because it is a very important part of the Lismore area.
I've spent 8 weeks at the AMS here in Casino, and as part of that I spend 1 day a week on outreach in the communities, and that involves visiting their homes, doing medical clinics and engaging with the people out where they are.
The Western Sydney University students are really quite receptive, and a lot of that could come back to the diversity of the students and their own cultural backgrounds and their different understanding about what culture is and what it means to them. And to be able to sort of translate that, their own personal experience and knowledge to Aboriginal culture, I feel like it definitely enhances their level of understanding.
It's really nice to be able to see people as they're living their lives and not just as they're coming into the clinic.